A blood pregnancy test can detect pregnancy earlier than most home urine tests. Welcome back to the FemHealth channel, a health education channel made by doctors for you. There are two main types of blood pregnancy tests, both which need to be prescribed to you by a doctor or healthcare professional. The first type is a quantitative HCG test. This is also called a beta HCG test. This test measures the exact level of HCG in your blood. Because it can detect extremely low amounts of the hormone, it can be used to detect a pregnancy in the earliest stages. This may be ordered by a doctor when close monitoring is needed, such as during fertility treatments or high-risk pregnancies. The second type of blood test for pregnancy detection is a qualitative HCG test. Instead of measuring a specific number, this blood test simply gives a yes or no answer to whether the hormone HCG is present in your blood. It is still fairly sensitive and can detect pregnancy a few days before your missed period. However, the qualitative or yes-no test is not as precise as the quantitative blood test. So how early can a blood test confirm a pregnancy? Pregnancy can typically be confirmed in your blood as early as 6 to 8 days after ovulation. This translates to about 6 to 12 days after conception or sex. This timing lines up with implantation. Implantation is the process where a fertilized egg attaches to the lining of your uterus. After implantation happens, your body begins to produce the HCG hormone or the pregnancy hormone. Because HCG starts rising soon after implantation, a blood test can become positive as early as 7 to 10 days after ovulation. That means a blood test can show a positive result a few days before a urine test would. Also, not all urine home pregnancy tests are the same, and some tests can be more sensitive than others. There are urine home pregnancy tests that can detect a pregnancy 6 days before your missed period, and then some that you will need to wait at least a few days after your missed period. This is also unique with each pregnancy based on how much HCG your body is producing. With any urine home pregnancy test, the accuracy increases as you get closer to the date of your expected period. If you think you might be pregnant, you can start by taking a home pregnancy test, but be sure to also talk to your doctor. If needed, they can also prescribe a blood test.